What is hypertension and effects? Hi everyone. Welcome to MyDigiDoctor. I'm Dr. Lara. MyDigiDoctor is the fastest and easiest way to learn more about health subjects. What is hypertension and effects? It is now approximated that almost 1 out of every 3 Americans has hypertension. Blood pressure is the measurement of just how much force the circulation of blood places on the arteries. Blood pressure increases and falls throughout the day depending on activity levels, eating practices, and other conditions. When blood pressure routinely stays raised, it is called hypertension. Also called the term hypertension, high blood pressure is determined in numbers based on the diastolic and systolic pressures of the blood. Systolic pressure determines the force of blood against the walls of the arteries as the heart beats, while diastolic pressure determines the force of blood on the walls of the arteries in between heartbeats when the heart is relaxed. These two numbers are displayed in series from top to bottom. Systolic pressure measurement is on the top, and the diastolic is on the bottom. Healthy blood pressure is 110 to 70, with a systolic pressure of 110 and a diastolic pressure of 70. Hypertension readings vary for everybody and are difficult to determine because our blood pressure fluctuates throughout the day. However, healthy blood pressure is typically 120 to 80 or lower. A systolic pressure that regularly checks out from 120 to 139, with a diastolic reading of 80 to 89, is thought about pre-high blood pressure. Phase 1 high blood pressure is a constant systolic reading of 140 to 159, with a diastolic reading of 90 to 99. Phase 2 is anything regularly over 160 to 100. When the blood pressure is high, it requires the heart to work more than it usually does. The additional blood force against the walls of the arteries can trigger the arteries to solidify. Known as the quiet killer, this condition can lead to stroke, heart attack, heart failure, kidney failure, or loss of sight. There are seldom any signs. The only method to understand if you have high blood pressure is to have it examined. Hypertension can also be triggered by cardiovascular and kidney conditions, neurological conditions, preeclampsia in pregnancy, and numerous medications. High blood pressure does not discriminate. Anybody might develop it, despite gender, age, or race. The bright side is that this condition can be dealt with and avoided. While there are lots of medications created to lower blood pressure, there is likewise a way of life modifications that can assist. Reducing weight, workout, a healthy low-fat diet plan, and taking in less salt and alcohol will have resulted in decreasing hypertension. Regularly speak with your physician before making modifications in diet plan or workout, and have your blood pressure inspected frequently. Thanks for watching. Please don't forget to like, subscribe and share. Help us to spread health to the world.